Thank you for joining me today. Before I speak to this morning's report from the Privacy Commissioner, I'd like to provide a quick update on the vaccines. Yesterday, we administered over 12,000 shots, our largest one-day total to date. We are now vaccinating in a number of different communities, which means we can get more shots done more quickly. Yesterday, vaccinations were being delivered in Regina, Saskatchewan, Prince Albert, and several communities in the far north. This week, we will be starting in more communities, including Melfort and La Ronge. Next week, we expect another shipment of both Pfizer and Moderna vaccines, which means we can start vaccinating in even more locations. This is the point that I was trying to make on Wednesday, that if we get more vaccines, we can distribute them to more locations. And if we're in more locations, we can do more shots at the same time and get more people vaccinated each day. That's why we are asking the federal government for a reliable and increasing supply of our vaccines. I understand yesterday's call with the premiers and the prime ministers went well, with Prime Minister committing to make every effort to deliver more vaccines more quickly, and to ensure the provinces have a reliable schedule of what we can expect to receive all of our vaccines, so we are able to better plan the distribution throughout the province. I also want to address a media report that said that we were not to hold back the second dose of Pfizer vaccines that we received as part of the pilot program in December. I'd like to acknowledge that the public health officials on both the federal and provincial levels are working hard to ensure a smooth rollout of the vaccines, and we are working under constantly changing circumstances. I have confirmed with my officials that instructions and advice was received from the Public Health Agency of Canada on December 9th to, quote, always save half of your doses in order to ensure that you have enough to administer the second dose. And another quote, to ensure reserve of second dose for the second and third weeks of the initial vaccine delivery. Saskatchewan public health officials took this instruction seriously, and so did I. And I confirm with them in their diligence, and I commend them for their diligence in following these instructions. They were intended to assist the province in optimizing the initial delivery of vaccines that we have never worked with before. Now, going forward, as I said on Wednesday, we are no longer holding back vaccines of the second dose. Now that we have more experience with the vaccine and delivery schedule, moving forward for the next 2 weeks, we are able to forego the reserving of the second dose. And we look forward to continue to work with Health Canada and PHAC on optimizing our vaccine delivery and securing a reliable, consistent delivery schedule for this crucial vaccine in the weeks and months ahead. Now on to eHealth. Earlier today, the Office of the Saskatchewan Information and Privacy Commissioner released an investigation report examining eHealth Saskatchewan's cyberattack reported on January 10th. Saskatchewan people expect their personal health information to be secure and protected. It is clear that this expectation failed when eHealth systems were breached last December. The report issued today by Mr. Krushelnicki contains several troubling findings and recommendations regarding the data breach and subsequent events, and details in a number of shortcomings on behalf of eHealth, the SHA, and the Ministry of Health. Our government takes these findings and recommendations seriously and will commence work to address them immediately. In total, the report contains 25 recommendations directed to eHealth, the Ministry of Health, and the SHA. Due to the technical nature of several recommendations, a response to each individual recommendation will be provided to the Office of the Privacy Commissioner within 30 days. We will also be providing quarterly updates to the Office of the Privacy Commissioner outlining progress on the development and implementation of preventative measures outlined in this report. While a number of recommendations that are technical in nature will take time to respond to, I'd like to share a number of the immediate and planned actions to these recommendations. In the report, the Privacy Commissioner details delays in notifying the public properly regarding key updates of the data breach, including information regarding the impact of technical systems within the Ministry of Health and the SHA. This is concerning. While there is no confirmation of what the data breach while there was no confirmation of what the data was breached and left the control of eHealth, the public deserves to know and up-to-date information regarding a data breach that impacts the most sensitive information. So on Tuesday, December 22nd, eHealth and the Ministry of Health and the SHA provided mass notification regarding the extent of the data breach. This is in alignment with the Office of the Privacy Commissioner recommendations to do so. This included notification through media releases, newspapers, websites notice, and also on social media. While this notification was provided on December 22nd, the delay in notifying the public in a more timely manner is concerning because it exposes clear oversights within the internal process of the ministry and the SHA. As such, I have ordered an internal review by the Deputy Minister of Health into the Ministry of Health and Health Authorities' decision-making process, which led to this delay. The Privacy Commissioner also included a number of troubling findings and recommendations in regards to the governance, management, and program operations of eHealth. So in the coming days, I will be announcing action to address this recommendation for an independent review of eHealth's governance, management, and program operations. Details in regard to the response of this recommendation are still being finalized, but I expect to be able to share more information next week into the immediate steps to address the review of the governance, management, and program operations issue that were pointed out in this report. Before I take questions, I'd like to conclude by thanking Mr. Krushelnyski for his thorough report and continued work protecting the privacy information of Saskatchewan people. Mr. Krushelnyski rightly notes that the current pandemic is placing demands on the healthcare system, which is inevitably caused with some delays in the response to each recommendation. And while this is the case, the security of the personal health information of Saskatchewan residents is the utmost importance. So I agree with the assessment that officials should begin to work on this as soon as possible and conveyed my expectation that this request and timelines should be met. And I'd be happy to take any questions.
December 22nd, by December 22nd, your ministry had already received a copy of the draft. I wonder, what credit do you think we should really be getting for making a public announcement after you realized that the Privacy Commissioner was about to take you to task publicly for your failure to notify the public adequately for a year? Why should the public give you any credit when you just did it after you been caught by it?
I'm not looking at taking credit for this. Upon receipt of that report, I thought it was prudent to notify immediately, and I had asked my ministry and the SHA and eHealth to put the information out so people knew what had happened.
Was it really the case that that was the first time the ministry knew about this? Like, where's that was not the first case that the minister or the commissioner brought these issues to your attention. You've been dealing with it for a year.
Yep.
The ministry was slow to respond to him, slow to provide information to him. So what is your assessment of why it took receiving a damning report for you to take action?
And that's exactly why I've asked my deputy minister to look into this. I've asked to look into what was the delay internally, why was this information not out there sooner when we knew about it. Some of the initial reasons is that I've been told is we didn't know the depth, the absolute depth of where this cyber attack is. This was a very, very, as outlined in the report, a very, very sophisticated attack that eHealth had not seen before. So that's why I'm asking my deputy minister on what it was and the delay in the timeline to be able to get that information out to the public, because I feel it was very important that the general public knew the depth and the breadth of the breach that happened at eHealth.
Is it the right move to ask the guy who's responsible for the system that was delaying to investigate why there was delays? I mean,
Well, he would be.
he's the head of the ministry. He's
Correct.
He's the minister or the deputy responsible through which
Mhm.
eHealth is communicating. So why is he the right one to be doing that sort of review?
I have absolute faith in my deputy minister to be able to provide me with an unbiased report.
How do you know he's not the problem?
I think that that's a challenging accusation. This is a public servant
It's
that.
not an accusation, it's a question. You don't know what the problem is. You're asking the guy who's responsible for the whole ministry and the
Yep.
operation of it to investigate why this happened.
I feel it's important that he does investigate, and once he provides me with that information, I'll review it and make an assessment at that time.
So it's clear from the report that the privacy commissioner thinks this could have been actually prevented. So who is going to be held accountable for this, and what consequences are going to follow for failing to prevent something that could have been prevented?
Well, I think I've got to go through all the detail. There's 25 recommendations in that, and I've read through the report to be able to see what exactly was the cause. There was one where somebody had plugged in their personal iPad into the system, and that caused a breach. I'm very concerned about this. I think it starts with the governance at eHealth to make sure that people are properly trained and they have all of the equipment to be able to make sure that they make the proper decisions. And GUARD, which is some information which is very sacred as people's personal health information.
It says that, eHealth was not even aware of a list of these servers and where they were located. How did that happen, and what needs to improve in terms of the organization?
Sorry, I didn't catch the question, Arthur.
I'm trying to make sure I'm actually asking for Zach here. I'm just making sure I'm properly.
Yeah, that's right. The servers, they had to have a cobbled together list of the servers because eHealth, according to Saskatchewan, had no idea how many servers they had, what they had, where they were. And so they had to scramble in the midst of the crisis to figure out what they needed to secure.
And that seems like a pretty basic thing to know what your servers are and how many you have. How could they have made such a egregious error?
I'd have to dig into that a little bit more and talk to my officials exactly what happened in that specific case. But again, I can't reiterate this enough that this is very important and it's very concerning to me. I mean, at the end of the day, I'm responsible for this. And the concern is that people's private information, very personal information, could have been exposed.
The report says, it quotes from this report that Saskatchewan did looking into this whole matter. And Saskatchewan's report concludes that eHealth didn't have the personnel, didn't have the authority to do the job it needed to do to fulfill its mandate to have a secure system. If it doesn't have the authority and it doesn't have the personnel, that seems like a problem of governance from above. What's your assessment of what's going on there?
Well, I would say that there seems to be a problem, and it starts at the top. There's a responsibility at the board level, of the senior management level, right down to the individual level on protecting anybody's personal information. So I see that there are some challenges with the board and with the management, and it's something that I'm going to be talking to my officials about later on this afternoon and first thing on Monday morning.
Kind of to Arthur's first point, has any action been taken against any management or the board of directors?
No.
And will anything be?
I can't comment on that. I have to sit down with my officials and be able to go through everything with the detailed report on this, and but I'm not ruling anything out.
The Saskatchewan report also says, looking at this from a cybersecurity point of view, this has resulted in a hodgepodge of unintegrated security systems being deployed, various configurations being operated in various parts of the organization. And any basically about a dysfunctional organization, where there are competing fiefdoms internally and where there are systems that don't work together. We've known this for a long time. There's been many reports about this. Why is there such a cultural problem being allowed to exist inside eHealth?
Well, I can't comment whether there's a cultural. I've met with
Read
representatives.
the report?
Yes, I did, Jeff.
Do you believe the report?
I said I accepted the report, yeah.
Okay, so you can't, I mean, we're dealing with the known facts. Well, why are we not able to comment on what we know? Or even, this
Well,
is
'cause
not a cultural problem, this is not concerning.
No. Everything about what happened at eHealth is concerning to me. And like I said, this is, at the end of the day, that the responsibility is mine, what happens with people's personal health information, and I don't take that responsibility lightly at all.
We were reported in December from a briefing that said that eHealth had been underfunded for years, and that there is, at least at the time of the briefing that I got, $150 million technical deficit, and that money needed to be spent immediately, and lots of it, $50 million a year, in order to get things up to date. How much of this is a money problem, and what is your assessment of the request from eHealth?
Well, I think that request, I took it as a new minister coming in, that this was a budgetary request. I get budgetary requests from all areas of my ministry. This was something that they had identified as that they would like to have as part of the budget on a go-forward basis. And it'll be part of the request will be worked in with all the other budget requests within health and considered through the budgetary process.
That, you don't see that jumps to the front of the line when you're talking about the security? I mean, it seems clear that part of the problem here is a technical problem. You have systems that don't talk to each other.
Well, and I think that to answer the question, you've identified a few things. There's some governance issues. There potentially could be cultural issues within there, and there could be some financial. So I have to look at all of those to be able to see what it is that I can do in the short term and the long term to make sure that eHealth is functioning at its best.
What's the number now? You have a current number. The number I had at the time, $150 million. Is that accurate? Is that what eHealth is asking for?
I can't discuss what's going on in our budgetary process.
I just want to ask a question.
Yeah, sure, Arthur.
I'm wondering, you said this week that the federal government had actually directed you to hold back.
Correct.
Vaccines. You're saying today that they had advised you to do so. So how did you get that wrong? And do you acknowledge that it may have been counterproductive to blame the federal government for something that was only advice that your own ministry decided to follow?
Well, it was when I talked to Dr. Shahab and my officials this morning, their reaction was very quick, and that's the federal government had asked them verbally, and we had written documentation to hold back the second dose on the first pilot project. And that was because at the time when that pilot project came out, we had no confirmation. We had some estimates of when the next supply. So if we went through that full supply of vaccines in December, we didn't know when the second dose was coming. We had no firm numbers as to when the second dose was coming, so we had to hold that back to make sure that we had the second dose in the appropriate amount of time. As I announced, and Dr. Shahab and I talked about, we're not doing that anymore because now we have some firm numbers coming from the federal government. And also, the other thing is the federal government was identifying that we may get up to 11,000. That's been reduced down to 6,800 on the Pfizer side of things. So this is continuously changing. So in the pilot program, we wanted to make sure that those first doses, that we had them that were secure, that were identified multiple times in us up until what I've been told as of this week, to make sure that we continue to hold our second dose. We've chosen now that we've gone through things with one run of Pfizer on the pilot program, that we're confident that we can use all of the vaccines that we get on the first dose.
But how is it fair for you to blame the federal government when it was really your own ministry that decided to follow that advice?
Well, I think that the federal government had strongly recommended and advised us that we should be doing this. And at the time, we wanted to make sure that we had a secure amount of vaccines going forward. We did not want to disobey the rules of what the federal government and Public Health Canada had outlined for us. We wanted to make sure that we were doing what they had recommended. And this was the discussion went back and forth on many things with their recommendation, as far as our sequence, but also on the timing.
In just a few days, the current suite of public health measures is going to expire.
Correct.
Yet, the 7-day average is still well above what Dr. Shah has set as a target for getting sustainable numbers. Have you yet ruled out the possibility of significantly relaxing the current suite of measures on January 15th?
Well, our 7-day average is sitting about 254 right now, which is concerning. But it's not unexpected. We anticipated that there was going to be a surge of cases after the holiday season, and we have seen that, and it's come to fruition. I don't think it was as bad as we initially thought. There are some high numbers. Today we had some challenging numbers again. I don't know if it's been out right now, but it's 336. That's a high number. And I think we want to, again, if I can emphasize this more and more, we need to adhere to the public health guidelines. That's going to be the #1 indicator on how the measures go in next week. I met with Dr. Shahab, like I said, today. We're going to continue to see what the numbers do over the next little while. And we're looking at making an announcement or a press conference probably early next week to be able to decide what we're going to do from January 15th on. But as you've seen in other jurisdictions across our country and around the world, they have tightened up. So again, we want to make sure that we have that information, accurate information, up to date to decide what we're going to do over the next 14 to 28 days.
Are you considering the kinds of strong curfews and lockdowns that we see in places like that?
I don't want to speculate. Again, this is coming from Dr. Shahab's advice. We did talk about some preliminary things today on what he was seeing, and he identified the same thing as we've all identified, is the numbers are trending in the wrong direction right now. So again, we'll get together early next week and decide what we need to do as far as measures. I don't want to look in a crystal ball and be able to say what's going to happen. Dr. Shahab will have a conversation with us and we'll make a decision early next week.
Back to eHealth for a quick second. Given that, according to eHealth, one of the major issues is a major cash injection that's needed, and given that we don't seem to have a tremendous amount of money floating around, I wonder if the government has or would consider privatizing this system, I guess similar to what's happened in, say, like land titles or that sort of thing, or a public-private partnership of some sort. Is that one of the things that the government would consider?
I've never heard any conversations about that.
Just want to go back in time for a second to late October. And when you became minister, did you have a chance to review these 14-day forecasts that the SH was developing?
The modeling?
Yes.
Yeah, absolutely. That was one of the things that I looked at, is what's the modeling, what's it predicting? And again, the modeling that we have is a forecast, and it's not always, it's trying to trend what could happen, worst case scenario a lot of the time, so we can prepare for that. But when we make our decision on what we're doing, the modeling is only one piece of that. It's what's happening, what we're seeing in our hospitals, in our healthcare system. Also, what is our numbers, which way are they trending? And we're also looking, and Dr. Schwab is also looking at what our counterparts are doing across the country to be able to make sure that that our modeling is accurate, but it is only one piece of the decision-making process. It's an important piece, but it's not the determining factor.
At that time, those models around late October, early November, were pointing to an exponential growth trend
Yes.
in the next 2 to 3 weeks. Very similar to what we ultimately did.
Yep.
Why at that time did you not see that as a strong reason to take urgent action? Because there were no additional public health measures taken from the election until November 13th. So why wait those 2 weeks when you had information in early November, late
Yep.
October that seemed to point to exponential growth?
If you look back to right around Thanksgiving, you will see the numbers that trended in a very challenging direction. They were trending upward continuously. And from that point in time, we were looking at and implementing different measures that were getting stronger and stronger and stronger. To our strongest restrictions, outside of March when we initially locked down, our strongest restrictions in the second half of 2020 came at Christmas time. So they have been increasing all the way along. And again, the modeling is just one piece of that. At the time, we wanted to make sure that we were reacting to what we saw, not what that could come on the horizon. And again, as I say, that was a piece of the overall decision-making process, but not the end-all and be-all. You'll also see that those numbers were trending to 600, 700 to thousands a day, which because before and after. But because of the good work of the people of Saskatchewan and adhering to the public, we never saw those numbers.
Sorry, just going back to the vaccine, the kind of worry that was raised, I guess, why was it decided to kind of place the blame at the feet of the feds and say it's all us all, and instead of coming out and say, we're kind of just waiting to see what the situation is like regarding inventory, and then we'll put it up by trying to blame the feds?
I wasn't trying to blame the federal government. I was just simply reiterating what the federal government had told us to do, which was hold back the second dose. And up until this week, they were still telling us the same thing. So now that we feel more comfortable with the process of what we're doing with the vaccines, we feel now that we can use all of the doses that landed in Saskatchewan as a first dose. And then when the next shipment comes 3 to 4 weeks later, depending on which vaccine they receive, then we can get that and get them into their second dose so we're fully vaccinated, which we are doing. We just had our second doses in Regina that people are fully vaccinated now, which is a great thing to be able to say. These are the first people that are fully vaccinated with the Pfizer in Regina, and very excited that that's happening. And again, it was very focused on the primary healthcare workers in our COVID wards.
When did that directive from the federal government change this week? Was it just yesterday you found out we should start getting out, or earlier this week?
As far as I know, it hasn't changed from the federal government in that second dose. We have made the decision here in Saskatchewan with some other provinces that we would use all vaccines coming in as a primary dose, and then once people get to the point where they've had that 28 or 21 days, depending on which vaccine they've received, then we would give them their second dose.
Just to make sure, I'm not sure if I missed something here, but related to the question of modeling, the Premier of Ontario has said that he's going to be releasing some modeling next week.
Okay.
That's showing some very troubling signs in Ontario.
Mhm.
And I'm wondering if you could say, I mean, you're watching the modeling, are you seeing those sorts of things? You said, not just with the modeling, but with lots of other things, I get that. I'm asking about the modeling specifically.
Dr. Shahab is committed, I believe, every 3 to 4 weeks to coming back with some modeling if that's the case of what the BD would like. I look at the modeling all the time. As with Dr. Shahab, obviously this is his area of expertise with modeling. Once he makes his assessment on what the modeling is, that will determine what we do as far as our restrictions.
When's the last time you looked at updated modeling?
That I've personally looked at update on modeling, it was probably last week.
And presumably, if Dr. Shahab saw stuff in the modeling that was troubling, he would bring that to your attention. So presumably, we're not in the same place as Ontario. We don't have stuff we're seeing in the modeling that's causing alarm, or does that just mean you haven't been told about it yet?
No, I think, again, the modeling is a piece of the decision-maker process. I'm not familiar with what Ontario's seeing. I know that they've had record case numbers in the last couple of weeks, which I'm sure they're very concerned with and they're dealing with. But I'm looking at the modeling, but I'm also looking at the case count. I'm also looking at the hospitalizations and the ICU.
I'm wondering what you would say to Saskatchewan residents who might be concerned, like you're talking about addressing these issues with the eHealth system in the future, but that information's out there, potentially over 500,000 files of anything personal health information that could end up anywhere. Somebody could wake up potentially and have much money taken out of their account or identity stolen. So I would say to people who are concerned that might appreciate that you're addressing this issue now, but might be scared that this information is out there already.
We've been monitoring various areas of the internet and the dark web, which I'm very unfamiliar with, but we have people that are monitoring that to make sure, as it was identified in the report, that we're continuing to see if anything pops up, and if anything does pop up, then we will work with any individual that needs some reassurance that their privacy hasn't been breached, or it isn't being sold, or they don't have identity theft.
Thanks, everyone.
Okay. Thanks, guys. Have a good weekend.